Hello again, Dr. Dave coming to you today from the great outdoors. It's nice and sunny today. And in the previous video, I was talking about encouraging people to get professional help for their problems. But in this video, I wanted to talk a little bit about what is needed to make therapy work and how to be an ethical therapist. We may get into some of the biomedical approaches too. So there's a lot of things necessary for therapy to be successful and effective. A lot of it comes from the person seeking therapy. First, they have to admit that they have a problem and be willing to get the help for that problem. Then they have to show up for their appointments, and they have to really be honest with the therapist. It's tough to do sometimes with a lot of the issues that they're talking about that maybe they've never discussed with anyone before. And they have to be at least willing to change, and that's a tough thing for a lot of people. There's a number of things that we need from the therapist, though. For starters, we need an accurate diagnosis, although in part this is going to depend on the patient's honesty. We need a therapist who can use a variety of approaches to help people, and it helps if they know a bit about the issue that the person is dealing with. For problems like anxiety and depression, most therapists are familiar, but with some issues, if they're less familiar, they may need to make a referral. Or especially if it's in small town America, they may need to learn a bit to be able to better assist their patient. Therapy is going to take a bit of time, and in part just because you don't get these problems overnight, and they take a while to help you emerge out of them. The other issue, though, is that it takes a while to establish a good level of communication between the patient and the therapist. So with that said, you need to be an ethical therapist. And while there are a lot of ethical implications that are put down by the American Psychological Association, I really want to spotlight a couple. One is that your therapist should only be your therapist. You shouldn't really have any kind of relationship outside of therapy, either before that time or after. So in terms of before, if you already are familiar with your therapist and your therapist has some kind of relationship with you as a neighbor, a friend, a relative, ethically they are not allowed to be your therapist. Likewise, on the other end, after they have served as your therapist for a period of time, they should not knowingly enter into any other kind of relationship with you, business relationship, friendship, dating relationship, and so on. Now, sometimes things can't be avoided. Maybe your therapist happens to move in next door to you, or maybe you're the only mechanic in town and the therapist has a car that needs servicing. Therapists are encouraged to make the best of those challenging situations, but if they can be avoided, therapists are supposed to avoid them. The other ethical issue that I wanted to bring up is that therapists need to keep confidentiality. In other words, whatever you say in therapy to your therapist, the therapist should not talk about that with anyone else. Now, yes, they can talk with other psychologists for consultation, but even then they can't give away your name or identifying information. If you talk to them about past crimes that you've committed, they will not reveal that. About the only time confidentiality will really be broken is in the case of child abuse. If the therapist knows about it or suspects it, they do have to report that to Child Protective Services because they have an opportunity to get the child to a safer place. But with any past crimes that have already occurred, they can't be undone. Future crimes too, it's a little bit different. If you go to your therapist and talk about a plan to hurt yourself or others, yes, they can reveal that because they can prevent a bad thing from happening. If it's court-appointed therapy, yes, the therapist may need to touch base with the judge to let them know what's going on. But beyond that, generally, whatever you say in therapy will be strictly between you and the therapist. Hope that helps you understand what it's like to be a therapist a little bit better. See you in the next video.